Hey everyone, welcome back to my channel. Today I want to talk to you about something that I love doing personally and we do a lot of in our clinic, and that is called light dentistry. Light dentistry is a very simple cosmetic procedure types of cosmetic procedures that we do that will help improve your smile and your function and give you that beautiful smile in very short period. If you'd like to hear more about light dentistry and how maybe some of these things could help you with your smile, then let's get started. Light dentistry. The definition of light dentistry, and I mean, a lot of dentists may have different definition for this. So for me, light dentistry means dentistry that is very simple. There's some simple changes that we can make to the teeth and the smile that will make a huge difference. It is not very time consuming. It's probably takes anywhere from, it could be 1 to 5 appointments, maybe maximum. Easy for the patient to get in and out. It's not really time intensive. Another great thing about light dentistry is that it's usually fairly inexpensive, and so a lot of people who they just don't have the funds or the ability to improve their smile with more expensive procedures like crowns, veneers, and things like that, this is very applicable. And this is really something that I believe, honestly, is I'm doing something good for the patient. Sometimes as dentists, we feel like we have to do these bigger procedures, crowns, veneers, but often our patients really just need very simple changes that are not invasive. They're very comfortable for the patient, and we don't harm the patient in any way, but yet we give them that smile that they really want. So for me, light dentistry, like I said, is, it's not very time consuming, it's inexpensive, and these little changes that I can make in your smile can make you feel wow about it, and just realize, it isn't something big or expensive or time consuming that we need to do in order to give you more confidence with your smile. One of the reasons why I thought to talk about this is something I've been doing for years. We are a digital smile design clinic now, and of course this is something that's been a term that's been coined, and it basically packages it all together so that you as a patient can understand it. But I've been doing this for a long time, and I didn't realize that it's something that if you it's in how you show the patient or you explain it to the patient would make people realize that it's something that anyone can have. So I want to talk about it. I've recently did a couple cases just this morning using light dentistry, and it got me thinking, what am I going to talk about today? Let's talk about light dentistry. So light dentistry is often in our clinic. What will happen is the patient will come in for regular documentation records. We digitalize the patient with a scan, we take photographs, and a lot of our patients are coming in because they're looking for an improvement in their smile, or they're looking for just, they're unhappy with certain aspect of their smile in pictures and whatnot. I recently had a patient, and I'm going to be showing this patient as an example in this case, is he came in to me. He's a owner of a dance studio. He's, with the public. He's really, concerned about his smile, never liked his smile. He came into me a few months back and he said, Peggy, I think I need veneers. I heard you do veneers, and can you tell me, what that will cost, and so on. And the first thing we did, like I said, we'll do the documentation. We do a lot of photographs and video of the patient smiling and talking. We are a digital smile design clinic, so we do digital smile design records, and these are very unique records that help us look at the patient and figure out what would suit their face. So not just give you, nice straight white teeth, but say, okay, what type of teeth, what shape of teeth would look best for you, your personality, your face. So the first thing we did actually is I got I have a DSD app. It's called the DSD app, and it's part of being a DSD clinic. We use the app regularly, and what we did is we did just sort of a mock-up design on the iPad with the app just to give them an idea. Now, when I first looked at this, I too wasn't sure whether or not it would be, a combination of things, or maybe it would just be veneers. But after an exam, and again, looking closely at the app design, I thought, we could really do some simple changes here that will make a big impact. And so the first thing I suggested that we do for Justin was to align his teeth. He had an open bite, so the upper teeth and the lower teeth do not close over one another. So there was a gap between his teeth. There was what we call a cross bite. So 2 of the teeth on the right side are actually in the reverse bite. And he had very large canines. So the canines were kind of sticking out very far wide, and they really looked like not in proportion to the rest of the teeth. And they also were very worn. So he had a lot of wear on his teeth. He was grinding his teeth. Now, the first thing he said to me is, can I have veneers or should I have veneers? And I typically don't. He's only in his 20s. We try to avoid, prepping the teeth or cutting down the teeth especially for people who have never had any dental work done. And he had, beautiful virgin teeth. I didn't want to do that. So I looked at his bite and I said, well, definitely you could benefit from Invisalign. What if we just move the teeth first, try to get them into the most ideal position possible, and then we'll see where everything shakes out. So based on the design, he liked my DSD app design. I showed him with a simulator. We have a simulator with our iTero element. We can simulate where the teeth should go, just a rough idea. And he kind of could see it. And so that was sort of the start of getting him, feeling comfortable with starting with a small step. And that's the thing about Lite Dentistry is that often, we don't want patients, we want to develop a relationship with the patient. We want to make them feel comfortable, and doing something simple and non-invasive like Invisalign is just a great way to do that. So we did that. He was in Invisalign just a few short months, and very quickly we started to see a reduction in the open bite. So his bite became normal. The cross bite was corrected. And the one thing though that we couldn't fix was the wear. He had a lot of wear on his front teeth, on his canines in particular. I could move them in, make them look less, protrusive, but I couldn't repair, I couldn't make them look like nice, natural, new canines again. So what we want to do with Lite Dentistry is then once teeth are lined up, and often Lite Dentistry will involve usually some alignment because a lot of people do have bite issues, and that's why their teeth are in the situation they're in. So we moved the teeth, then we did another design where we looked at, okay, where do we need to give back the length that he's lost? Now my restorations or my fillings or what you call my direct veneers or direct bonding that I was going to do on the teeth is going to last a lot longer because the bite is good. So it's really important that your dentist or anyone who's doing any type of cosmetic work really think about the function and the bite and how the teeth are aligned first. And that's what we did. So we got that down. He really started to see a difference. Now when we do Invisalign, we include whitening at the end. So we did gave him some complimentary whitening, and often our patients are, they whitening works, but you would not believe this. When he came in, I don't think I've ever seen teeth respond this well to whitening. And I did a whole YouTube video before on whitening, so if you want to listen or hear more about that whitening, check that out. But basically, the whitening was very effective in Justin. So now he's done Invisalign, he's done the whitening, and now we're going to the finishing touch is this little bit of extra additions to the edges of the teeth to give back that nice shape and give back that, to reduce the look of wear, because worn teeth look older and nobody wants older teeth, let's face it. But, it just made a difference. So that was like the most amazing thing, because for me, as a restorative dentist, as a cosmetic dentist, I feel better when I'm doing things for patients that they feel good about, that they can afford, that are these small changes that I'm doing is making them walk out the door feeling like a movie star. And it just changed him. And here he is. He's in his 20s. He's a small business owner, and now he's got that smile that really shows how confident he is. And that, I think, is even it has a ripple effect. I think it impacts how we act in our own business, in our own lives, and just to do these simple things and look what it's going to do for him. Now I know what you're really wondering, and you're wondering what all this costs, right? Because you're thinking Lite Dentistry must be cheaper. Yes, it is. Actually, it's generally cheaper than doing major dentistry, where we're talking about crowns, veneers, bridges, combination with orthodontics or implants, all these things. Those things can really get up there. So when you put it into perspective, Lite Dentistry, if I want to put like a ballpark, if you're including Invisalign, so Invisalign for most places in the world generally in around $5,000 to $6,500, $5,000 to $7,000 mark. Then to do that, the bonding and the whitening, you're looking at usually anywhere from $2,000 to $3,000 more. Now, to put that into perspective, that is not a lot for bonding, because a single tooth veneer would cost anywhere from $1,500 to $2,500 per tooth. So if you think about it, in Justin's case, for example, he got 6 teeth with the extra bonding, and it usually works out to be in around, let's say, an average of $500 per tooth for that. Whereas a veneer, if he had done the veneers that he had wanted, it would have been $1,500 to $2,000 per tooth. So what I love about it, though, and I want to make this point really clear, so hang on. What I would love about it is that with the Invisalign first, so doing the Invisalign treatment first, getting the bite right, then doing just the minimal bonding, I'm setting him up for success, and I'm setting him up for not spending very much money down the road. So let's say we hadn't done any of the Invisalign, we just masked all the bite issues with the veneers. He would have been looking at, upwards to $20,000, and then that, when it all has to get replaced again back, in let's say 10, 15 years time, he has to spend that all over again. What I love about Lite Dentistry, or about the fact that we do the Invisalign first for any type of treatment, is getting the bite right, is setting you up for success, because if the teeth are in the right position, then they're not going to break down as faster. So straight teeth age better, they don't damage each other, and then we really end up with restorations, could be veneers, could be just the direct bonding like Justin had. We end up with something that doesn't need to be replaced very often, because it's protected, it's in a good place, it's done in the right way to fit with your bite and your function. With actual, like I say, full crown and bridge, porcelain veneers, you're getting into implants and all these things, you're definitely going to be up into $20,000, $30,000. So, and you're going to replace it, in so many years. And don't get me wrong, every case is really different. So I don't want this generalization. But if I can give my patient a very simple change for less time in the chair, less money, and something that's going to last them longer, well, I'm going to be happier too. And I think that's just the right thing we should do as dentists. So I think a lot of dentists should be thinking more and more about Lite Dentistry, and thinking about getting the bite right, and thinking about using, tooth alignment first as a foundation. And then we'll have patients that are happier longer, and, with just, saving themselves lots of money. I'm really happy today to have shared that with you. Like I said, I do so many cases like that in my digital smile design clinic. We use the app, we give you an idea of what it could cost and what it will be right from the get-go. So if that's something that you're thinking about, or you have more questions about, absolutely, please message me. I would love to hear from you, and you can even send me some photos or anything you want. I can try to do, sort of a virtual consult if you'd like, but don't be shy. Get in touch with me and leave me a message. So until next time, don't forget to like and subscribe, and I will see you next time.